So I'm very happy to start this webinar, and I'm going to show you the subject will be a fascinating subject today of growth hormone and IGF-1 therapies. These are probably the most important therapies in the whole the hormone therapies because they have the biggest effects, and we'll talk about that. Now, before I will first introduce you, Dr. Mark Gordon. Mark, can you appear on the screen and put your audio on? Hi, Mark.
Hi, how are you, Dr. Hertoghe?
To be the other screen. So, Mark, I'm extremely happy to be able to interview you. I will interview in about an hour and a quarter. For the audience, Gordon is, following my opinion, one of the best doctors in the United States, and he's always a little bit before others. He's always searching something new, and he knows a lot about hormone therapy. So I'm extremely happy to have him, and I think you will learn a lot about him and me too. So, Mark, see you back at the end in about an hour and a quarter. You can take out your video and your audio now. And
right.
Thanks for being. Do you want to say maybe a little word more to the audience?
I'm just very excited about this webinar that you've orchestrated. It's a time that first time in 20 years that we'll be actually on the same stage together, yes, sharing our passion in growth hormone and IGF-1. And I agree with you 100%. It is the most important hormone in our body. I'll see you in an hour and change. Take care, sir.
Thank you, Gordon. Thank you, Mark. I'll see you a bit later. Yes. So now I'm going to show you my screen. Here it is. Here and there. So this is Mark Gordon. We'll talk about him a little bit later, and we'll have his live answers. I'm sure it will be fascinating. Now, what we're going to overview now is actually a model I'm doing for a teaching program called Evidence-Based Hormone Therapy. And in this model, we'll see all these different chapters, and we'll have a short overview here so that you will have a notion of what it's all about. So you have first a session on Growtomon deficiency and diagnosis with all the details like probably you never have had. One on Growtomon treatment, and we'll also give a little information about Growtomon fragments. Of course, in the model, you have much more information than I can give here. And IGF-1 deficiency and diagnosis is then another session. And then we have a session on Growtomon treatment problems, Growtomon IGF-1 in disease. And then we have Growtomon IGF-1 beneficial effects in disease and patient cases. And then there in this model, there's sort of additional file with all the Growtomon controversies, and you will see absolutely important topics. Now, let's see I'll give you some information about Growtomon deficiency, how to diagnose the Growtomon deficiency. And in this session that is about 2 hours in the model and very short here, we'll talk about what the structure is of growth hormone, what the importance is, production, what happens with aging, also a lot of information about personal family medical histories that can point you to diagnose growth hormone deficiency, actual complaints, and also physical exam with a lot of physical signs. Doctors that know me know that I attach a lot of importance on all those physical signs, and then the lab test, serum, and 24-hour urine test, and that can be done. So what is growth hormone? What is growth hormone? Well, growth hormone is actually a very long protein with 191 amino acids. And in this molecule, you have fragments that have a specific action. For example, if you go, so it's a chain of 191 carbon atoms. If you go from carbon atom 4 to 15, that part can decrease the blood sugar level by increasing the uptake of glucose in the fat cells. And then the fraction 6 to 13 gives a modulation of liver insulin receptors. So it's all about balancing the sugar level in our blood. And then we have a fraction that is here that is also important for the glucose uptake. And you have a fraction going from carbon atom 44 to carbon atom 91. That is about somewhere there, from there to there, all this section. And that does the opposite of what the first fractions do. They produce insulin resistance and increases the insulin. So it's a long fraction, and that explains why Growtomon has predominantly an effect of increasing the blood sugar level so that the muscle cells and the brain cells have enough sugar. And then you have a fragment here that is the red fragment here from 176 to 191, and that increased the binding to the Growtomon receptor so much that it has a very strong effect to decrease the fat mass, especially where it's worrisome, where there are more troubles when you accumulate it in the abdomen. So it decreases abdominal obesity, and that fragment is used separately now to just reduce obesity without having other effects on the sugar level. And you have also Growtomon fragment 177, 191 that is made of 15 amino acids, one less than the other, but has basically the same effect. So let's look at the beneficial effects of Growtomon. And I want to tell you my personal history. I started at age 38. So that's about 26 years ago. I started Growtomon. And I started because I have had a patient who was dying, a patient I actually never saw, a patient in the United States, and we had to find something for that patient. And I read some information about Growtomon, so I'll say, I'll take Growtomon, maybe that helps. And Growtomon really changed my life. If I'm there speaking and I have so much tonicity and tone, I can tell you it's thanks to Growtomon. I feel the Growtomon effects. So when I started, I felt suddenly a sort of freshness. And I had to sleep 7 to 8 hours normally, and I was not fresh with that. Well, actually, I was sleeping 6 hours. It was enough. So I was really amazed. And then a patient said, "Doctor, I don't know how you can do that." And I didn't really remark that, but basically I was working on the computer, talking to the patient, writing something down on a paper. The secretary came in, I answered the secretary, I took a phone, I also opened up the door because special button for that. And all that in about 1 or 2 minutes without staying calm. So it permit multitasking. And also became very quickly, within the year, the president of 2 important scientific societies, international societies. So it was really amazing. I also can tell you, I won the elections in the medical board at age 38 before all the big professors, etc. So it was something amazing, and I attribute that to Growtomon. So it really changed my life. I became much calmer, I had better recovery and things like that. So I was reassured that I could try it to a patient, and I had a patient that was actually dying and were bedridden in her bed. And so that was a problem. She couldn't get out, and she was saying, "I'm going to die." So I said, "Well, try Growtomon." It's a patient who's terribly allergic to anything. You won't believe any product she takes. And she did tolerate Growtomon, but with fractions. So like 2 weeks and then again, but it did take her out. It gave her energy to get out of her bed, to do things and to survive better, I would say. The other case was a patient that had extreme exhaustion since 3 years. Don't imagine, she couldn't get out of her bed, but she did to go, but it was exhausting to do the 30 kilometers to go to my office and consult. And she was, we gave her testosterone with female hormones, we gave her cortisol, we gave her thyroid, but it just improved to 30%. And then after 3 years, she got a terrible intoxication with seafood. Everybody was sick, but she was there really literally dying. And she said to me, "Look, if you don't find something, I'm going to suicide myself." So I said, wow, what a responsibility myself. So I said, look, I have this treatment. It really gives me energy. Why don't you try it? Oh, she said, but what you're telling me, it's much too expensive. I'm not going to do it. Give that to the heritage of my children. I said, no, this is, try it at least with one little vial. Try it for just a week, because she didn't want to inject herself and things like that. And after a week, she tried it. She telephoned me and she said, look, it works. And then she stopped. And then she fell back in her terrible collapse. So I said, look, when she phoned me back, take it again, take it 3 weeks. And then of course, she was not so disciplined. So she took it 2 weeks and she was much better again. She stopped again, crashed again, and then said, I could easily convince her, look, take it all the time. And she took it all the time. And she got all her energy back, because she was, her husband managed a big bus company. And that was a lot of work. And before she used to work, but there she wasn't working anymore. And now she could work again and help him manage all that big bus company. And I can tell you, things went very well during 2 years. And then something terrible happened to that patient. One of her sons suicided herself, and she discovered it in the living room. And so that was a terrible sight. You would say she would collapse. Well, no, she didn't collapse. She found a spiritual meaning in it. She was the one who supported everybody. She was very brave, but she did say to me, look, if I wasn't on the multiple treatment, but especially on the Growtomon treatment, I would have collapsed. And now I didn't collapse. So I thank you for that. So that shows the importance for some people, certainly with people's exhaustion, of Growtomon. And I think Dr. Mark Gordon will be able to testify that. So here's an article I wrote, consequently 25 years ago, that it gives a good resume, still very valid, about what Growtomon can do in aging adults. And so what does it do on the mind? Well, Growtomon is the hormone of the leader. It's a big boss or spiritual master, the person who stays calm, and everybody's panicking because there's fire here, there's fire there. Well, he will stay calm and distribute the roles easily because he finds solutions all the time. So Growtomon gives power. It gives you power back. What I have now, I have power back with Growtomon. It gives a bright intelligence. It also gives you sort of lucidity. You have an insight. You see what is important and what is not important. Really, very important. You won't do the accessory things when you're on Growtomon. You'll delegate that to other people, but you'll do the important things so that there's no delay. Multitasking, talk to you about that. Memory really enhances memory. It gives you also on the energy level a really feeling of freshness. The feeling I had when I started is spring is back in my life. I had forgotten that I got tired, and I had the freshness back of age 25 when I started. And energy, stamina, recovery, really something where you recover quickly. You don't need so much sleep because you sleep deeper with it. So it gives a sort of serenity, inner peace, but very deep. It takes a lot of those parasite anxieties away. And it does give you spirituality. I really, if there's one spiritual hormone, I would say this is the one, because it calms you all over. All your muscles are calm, your nerves are calm, and you can see reality as it is. And I can tell you how I feel it. It is really gives me a lot of enthusiasm. And deep sleep, it really improves the deep sleep. And so what does it do on the body? Well, you already know it, because you know that when there's Growtomon deficiency, the child will grow up to a dwarf. It won't grow a lot. And that's why the name is there. It's a very strong and potent anabolic hormone that increases the size and gives you a sort of, makes you a giant if you have an excess as a child. So it really gives a big difference. Small or big body are determined by the level of Growtomon. And so, for example, in a person who's obese, for example, untreated Growtomon deficiencies for 18 years, that person is obese like this, initial condition, look at what the change in 2 years' time with Growtomon, not on the lowest dose, on a good dose, but see the difference. The fat is gone and the person looks much slimmer. This is a dexametry. And what does it do on the body then is I consider Growtomon as a youth hormone, a youth-giving hormone. It partially maintains youth and reverses aging in those who are old and are not taking it. And so it gives power, a deep and relaxed breathing, toned and relaxed muscles. It lowers the fat mass, and it also gives fertility. I had a patient with azoospermia, no sperm, no possibility of sperm. You gave him a Growtomon, was a stimulator of sperm making, but that didn't work. And with the Growtomon, it worked. He had his sperm back. Thick scalp hair, thickens your hair. It gives a younger, toned face. It really stretches your face, gives thick and elastic skin, and a strong heart. It's used in heart failure. Relaxed, healthier intestines. In people with irritable bowel syndrome, they really are suffering. It really can relax the intestines. And it also decreases the degree and the incidence of age-related diseases. Can decrease obesity, type 2 diabetes, osteoporosis, hyperlipidemia, and atherosclerosis, heart failure, hypertension, stroke, Alzheimer's disease. So it's really a very important hormone, and you know it because something that changes the body so much that it can grow into a giant is a strong hormone. So what are the productions of Growtomon and IGF-1? Well, first of all, many of the beneficial effects of Growtomon are made through IGF-1. So what is IGF-1? Well, first, the pituitary gland makes Growtomon and secretes Growtomon that will come on the liver. Growtomon can also stimulate the making of IGF-1, not only in the liver, but also in other tissues, like, for example, the joints, but mostly in the liver. And the liver makes then IGF-1, and IGF-1 is insulin-like growth factor 1. It makes I estimate about 60% of the effects of Growtomon are through its stimulation of the production of IGF-1. So it's IGF-1 that does a lot of the effects of Growtomon, including the growth promoting effects. And with age, these levels do not stay stable. So at age 30, for example, after age 30, the Growtomon levels start gradually and excessively to decline. And then comes a progressive increase in Growtomon deficiency that gives us specific complaints and physical signs, and with also higher risk of disease. So after age 30, we start producing insufficient levels of Growtomon. And so you see this here. For example, at age 30, this is the nighttime serum Growtomon. The Growtomon is mainly secreted the first 3 hours of the night. And the levels are high in 30 years old. And then it starts really to decrease a lot. And so you at age 70 to 80 years, you have 50% of adults of that age have no Growtomon in their blood, or the peak is so slow that it's not detectable for the testing kits. And that gives a consequence, aging. So how frequent is Growtomon deficiency? Well, all adults above age 30 have lower Growtomon levels. So this person is about age 20, 25, Growtomon sufficiency in most cases. But then there's a gradual Growtomon deficiency with aging. And the Growtomon deficiency symptoms here that appear then are psychological. Some of those are, for example, anxiety. When I stop taking Growtomon, my anxiety comes back. I have little parasite emotion. I overreact a bit to what happens, and I feel anxiety without any reason. But now I'm on Growtomon. I can tell you I had absolutely no anxiety to start this webinar. And excessive emotions you have. So people dramatize. They seem to have anger outbursts, anxiety outbursts. They dramatize what happens, overreaction. Actually, how can you understand that? Well, an older person has the level of growth hormone of a dwarf. So actually, when a dwarf meets a giant or tall people, he has anxiety, of course. So if you have a big body, but you have the levels of a dwarf, you'll react like a dwarf sees the world. It's too anxious. And that is correctable with growth hormone. There are also sharp verbal retorts that appear. And 65%, this was a study I published, the one I showed you in that article, I published also findings I had on my patients before and after growth hormone treatment. And here other, so you have other signs like, and one of the signs, the complaint is this terrible exhaustion. You sleep 12 hours in your bed and you're still tired, you don't recover. And so many people who have severe growth hormone deficiency, they are unemployed because it's too scary for them to go out and work. And there are also physical signs of growth hormone deficiency. When you look here at this big body, for example, you have here, this body looks fine, but with adult onset growth hormone deficiency, this is how the person looks. So what happened in this patient had a tumor in the pituitary gland that was removed. But with removing the pituitary gland, there's a lot of hormone secretions that are faulty. So they supplemented all the hormones that that patient needed, except growth hormone, and that's the outlook. Without growth hormone, that's the change in outlook. So if you look like this, you're probably growth hormone deficient. And this is one of my first patients. And remember, the adult onset growth hormone deficiency, the growth hormone that starts in adults is the most frequent form of growth hormone deficiency. Everybody undergoes it. So he was 50 years and he had thinning of the hair, thinning of the eyebrow, droopy eyelids, deep wrinkles, and sagging cheeks. Sagging cheeks are really very typical for growth hormone deficiency because it's the sign that also reverses the best with growth hormone treatment. And this patient had a tremendous change actually with growth hormone. Now, when you look at such a patient, what you see, he has signs of growth hormone deficiency, sagging cheeks, for example, and this is how the cheeks should be if you have enough growth hormone all the time and you hadn't been too long in growth hormone deficiency. So growth hormone treatment is more or less that sort of aspect that we get, a sort of more tone of the face. And also very typically of growth hormone is bowed back, bowing over. It's not just a sign of aging, it's actually a sign of growth hormone deficiency, because when you give growth hormone to these bowed backs, actually the back is straighter. I call this you get back the royal attitude or posture that you should have. So they get much more relaxed in the back, but it's straighter in the back and they breathe more deeply. That's really an effect of growth hormone. So you can have a sort of buffalo hump. They say it's too much cortisol, but it's actually a lack of growth hormone because it goes away with growth hormone if you give enough growth hormone. And growth hormone deficiency is typically, it's a good sign, is to look at your palm and you press the palm. If it's too soft, that tissue, that is and you get that sort of pit, that's typically due to muscle atrophy. And that muscle atrophy is due to growth hormone deficiency and IGF-1 deficiency. So sharp ridges, when you pinch a bit the skin, you get those sharp ridges, typically in people with a lack of elasticity in the skin, typical for growth hormone deficiency in adults. Also here, you look here, the nails are a little bit more broken, and you have typically those longitudinal lines on the nails. It takes about 9 months, 12 months to get rid of that, sometimes 15 months if you have the right dose. So look at the nails of your patient. You see also here that the skin is thin. Thin skin is an atrophy. It's typically due to growth deficiency, but even more to IGF-1 deficiency. Growth deficiency is abdominal fat accumulates there, and then typically this droopy abdomen. That's not testosterone deficiency in a woman, that's this growth hormone deficiency, because you lack this elasticity and the muscle tone that growth hormone gives. So how to interpret laboratory test? You need to have an optimal IGF-1 for your patient. And optimal serum IGF-1 is about the same that patient had as a young adult. And because the older person is actually have the same size, about the same amount of tissue, so he needs actually the same amount to feel good again and restore part of his youth. Now, what is very important to know is that this optimal serum IGF-1 is different from one patient to the other. We're not equal. Some need less, some need more growth hormone, and some need a lower and or a higher IGF-1. And among those is that taller men, you see, the taller you are, the higher the IGF-1 is, because you need a higher IGF-1 to remain tall, or you shrink, or you get bowed back and you have osteoporosis, for example. So basically, each 13% increase of the serum IGF-1 corresponds to a 5 centimeter increase in height in healthy older men and men with prostate cancer that this study was done. So really, you need to have high IGF-1 if your patient is taller. And also women actually have a lower optimal serum IGF-1. And because they have less testosterone, and testosterone potentiates the production of IGF-1 with growth hormone. And also because often women are smaller. That's also one of the reasons why they need a lower IGF-1. And many IGF-1 and growth hormone deficits exist within the reference range. What does that mean? That means that, for example, you have here in the laboratory test, the lower limit of young adults is situated around here, about 120 or 130 micrograms per liter of serum IGF-1, and the upper limit goes near the 500. So 95% of patients are within those two limits of patients at young age, because the older age category has lower reference range, which are absolutely not reliable. But those are statistical ranges, they're not health ranges. And I'll show you why. And that is one of the series of studies. At the lower 75% of these levels of serum IGF-1, inverse association have been found. What does that mean? That means that the lower the IGF-1 is, the more you have a risk of disease. And so you have more problems of your lipids being disturbed. There's more risk of atherosclerosis. There's the inner side of the carotid arteries of your neck by ultrasound are actually thicker. That means that there's more atherosclerosis significantly. And so the lower the level is, the thicker it is. The blood pressure is also higher at lower levels, increasingly higher the lower the levels are of IGF-1. The CRP, which is a parameter of inflammation, is also higher at these lower levels. And men have easier myocardial infarction or angina pectoris. They have heart pain easier. The lower the levels, the more heart pain. And there's also more mortality at these lower levels. So having high levels make you live longer as a human. And so also in the studies, they have divided these in quartiles, the lowest 25% and the middle quartile, etc. Those the upper quartile. So what are the healthy range? The healthy range is probably at the upper level for at least these parameters that are cardiovascular parameters and mortality parameters. Shows you the importance of having an optimal level that is not too low. And what about the growth hormone treatment? Well, this chapter that I will be seeing in a model, it's always more or less 2 hours or a lecture with a lot of I would say, very easy to understand slides, but important slides with the references. You will have a whole section on what other hormones can do to increase the levels of growth hormone. So you can, by giving thyroid hormones, for example, testosterone, increase the growth hormone levels, but not enough. Once the person is age 30, age 40, that it won't generally be 100%, not 100% sufficient. They will also abundantly talk about growth hormone treatment injections, how to give it, when to give it, and things like that. And also how to change the dose in the follow-up and remark overdose effects and other things like that. And then we'll have some information in this session about growth hormone peptides that can improve also the growth hormone effects that I give sometimes in conjunction with growth hormone. So let's see a bit about the subcutaneous injections of growth hormone. You shouldn't be afraid of injections. The needle is usually very thin. You put it under the skin, but what is important is that you should extend the skin. So you don't pinch the skin and then you get a bruise. No. So you avoid pinching the skin. You should extend the skin, then the skin is thinner, and you should actually inject oblique-wise, slightly oblique-wise. So not vertical on the skin. So you remain in the skin, and you have then a subcutaneous injection that is to give before bedtime. Now, in the follow-up, you can see the improvement of physical signs. So this is real picture. This is a patient I showed before, one of my first patients. He has droopy eyelids, and then you see the change. He has firm eyelids, and his hair is also much better, and actually his sagging cheeks are much less. Also, this, for example, the back, the bow tends back will become straighter with growth hormone treatment. So these are two major signs. There's many, many more. Doctors who know me well, I like to show a lot of pictures so that you really have a good idea of what happens when there's growth hormone treatment. Also, a fat, droopy belly, for example, typically with growth hormone and a hypercaloric diet, you will have an improvement of this type, this droopy belly that is typical for growth hormone deficiency, if I may remind you. And what about a growth hormone fragment? Well, here's AOD, that's advanced obesity drug, that was, I believe, discovered or produced in, fragmented from the big molecule in April 96. That's why it's 9604. And this is a fraction of the human growth hormone. And was initially designed as an anti-obesity drug. Like growth hormone, it increases the breakdown of fat and decreases the production of fat. And it, especially in the mid-abdominal area, it seems to decrease the fat. So this can be useful, but difficult to be available. And so this is more or less what could happen with the growth hormone fragment, but you still need to be careful with the food, have an improved food and decrease the food to get that sort of result. For example, many studies actually, of several studies, not so many, but have been done on mice and on typically the obese mice like this, where it showed that the rate of glucose incorporation to the fat cells were actually decreased by this growth hormone fragment in adipose tissues. And you also had increased breakdown of fat. So this that is measured by the concentration of glycerol, that is breakdown product of the fat and of triglycerides. And you see here that it's increased by IOD 9401 is even another fragment actually that is a little modified from this fragment. And but it also has other effects. It can, for example, decrease cartilage degeneration. So this is cartilage degeneration. You see all these plaques where tissue is also missing in the cartilage, and caused by an injection in the cartilage that damages the cartilage. And you see this is in rabbits, and you see that if you put hyaluronic acid, you have good effects actually. But if you put iodine 9604, you also have even better effects, actually, when you look at this part at least. And then you, and if you give the 2, then you really have a healthy cartilage. So it shows that other effects can be, but if you inject Growtomon, you probably will have even more potent effects, in my opinion, than with this fragment. So I use Growtomon. It's also available at the pharmacy. Then let's talk about IGF-1 deficiency and diagnosis and treatment. Here we'll go over like personal and familial medical histories of people having low IGF-1 in the family, actual complaints, physical exam. They give also physical signs, the lab test and serum, and IGF-1 treatment with subcutaneous injections, and long-acting IGF-1 and Mechanogrowth Factor, which are actually very closely related, have the same structure as the IGF-1. And then other hormone supplements will be discussed that can increase IGF-1 levels in this lecture, and also how to solve problems with IGF-1. And so let's look a bit at the structure of IGF-1. And you see this is a smaller molecule actually than Growtomon. And it has some similarity with insulin. It's because you have those disulfide bridges that are also there. And so it has some of the action of insulin, but not much, like 3% on a weight basis compared. And so what is, and that's also why it's called insulin-like growth factor 1. So what is about the production? Well, IGF-1, as we know, is produced here in the liver, mostly. And I estimate that there's about 250 to 400 micrograms per day that are produced. So if you have to give a person has a full deficiency, that's more or less the amount that might have to be given, although higher amounts are given often. And in childhood, when there's an IGF-1 deficiency, the face does not develop. It's more severe deficiency actually than a Growtomon deficiency. So you have not much face development, and the child is also smaller. So this is a Growtomon deficient child. This is an IGF-1 deficiency. You see, they have small features. The features are better developed in a growth deficient child. And the Growtomon deficient child that has some IGF-1 is taller than the one who doesn't have IGF-1. So in adults, IGF-1 deficiency, it gives more atrophy. Growtomon is more a hormone that tones the body, gives more elasticity, decreases fat. That's there. But here, IGF-1 thickens the skin more, thickens the bones more, thickens all the organs more, the hair more. When I started to have IGF-1, after 2 months, I had the impression my hair had doubled in volume. So I was amazed. But 1 year later, I had the impression it was 3 times more volume. And it's still very thick now because I take now Growtomon with IGF-1. So eyebrow thinning, nose thinning, thin lips, very thin lips, typical for IGF-1 deficiency. Look at these thin lips here. Very strong atrophy. There's certainly IGF-1 deficiency. It won't be sufficient after age 50 to give only Growtomon. You need to give also IGF-1. So differences are important, but there's one advantage of IGF-1 compared to Growtomon. There are several advantages, is that it decreases the insulin requirements of diabetic patients. So for diabetic patients, I start to give first IGF-1 before I give Growtomon. So for example, there are less insulin requirements in those diabetic patients who receive Growtomon. And it's safer, while Growtomon can increase the insulin requirements. IGF-1 also is strongly anti-inflammatory. So here, for example, the levels, if you have high serum IGF-1, you usually have lower serum CRP and lower interleukin-6. So people are inflamed, maybe inflamed because of a lack of IGF-1. And per standard deviation increase of IGF-1 levels, you have 50% less odds of having an excessive serum CRP. C-reactive protein is a marker of inflammation, the main marker that is used by most doctors. And there's also a 31% decrease in odds of having a high serum interleukin 6, which is an inflammatory cytokine. Also, something very interesting, and that's one of the reasons I give IGF-1 to adrenal deficient patients as a first treatment before I give Growtomon, if I give Growtomon, is that IGF-1 regenerates the adrenal glands. And for example, in one of those studies published already in 1990, is that you have cells here. This is in this capsule here are made all the important adrenal hormones that doctors are talking about. For example, in the zona fasciculata, cortisol is made. These are cortisol producing cells. And the zona reticularis cells, they produce DHEA and androstenedione. And a study here showed that IGF-1 increases the secretion of these hormones and also helps multiply these hormones. So there's more of those cells multiplying. So IGF-1 has a regenerative effect on all these cells. So if you have adrenal burnout and you need to have Growtomon or IGF-1, it's IGF-1 you have to start with. And even zona glomerulosa cells that secrete aldosterone also are more produced. Aldosterone is a water-retaining substance that is produced here in the zona glomerulosa, also improved by IGF-1. And then there's also some exciting information, because I also tested this information, is that IGF-1 treatment can decrease hearing loss, age-related hearing loss. There's a treatment. And there are actually two hormone treatments, aldosterone and this treatment. And so sensory neural hearing loss, typical for aging persons, they don't hear well. When you give IGF-1 treatment, and either because you put a little clothing impregnated with IGF-1 that you put behind the tympanic membrane, and you put it here, or you inject here. These both treatments where you inject IGF-1 here, because here is the problem of sensory neural loss, hearing loss. It's really on these structures, they are damaged or they are degenerated and they don't work well. And IGF-1 can regenerate this here. So after 6 months of such a treatment, 47.5% have some recovery, some slight, but 10% show the complete recovery. And 52%, so about half of the patients, did not help because maybe the problem was different or had not a cause. But when the cause is a low IGF-1, this will help. Now, there's another study showing also that reverses sensory hearing loss. And what I did is that I just put drops of IGF-1 in the ear, and then it improves. And it not only improves hearing loss, but it decreases the tinnitus that accompanies the hearing loss. Tinnitus is buzzing tones in the ear. So this was done with a gel foam, and this was an intratympanic IGF-1 injection. And actually, when you put this sort of gel foam here by surgery, you place it behind the tympanic membrane, 60% of the patients showed recovery because it was more constant effect. It stayed there longer. So what works even better is to combine IGF-1 and Growtomon treatment because there's synergetic effects. And this is one of the old studies already. There's so much science already existing long time before, and nobody talks about, nobody researches it. Here's one of those studies, and the rats where they have burned, actually, that's very cruel, I agree. So they burn here, and when they receive IGF-1 alone, they actually heal much quicker and they have better body weight gain. If they receive Growtomon alone, they will have even a better body weight gain. But if they receive the association with the two, they have a very strong body weight gain that is probably better than the controls. So that means that they recover better, they're healing better. Because normally those who are burned like that, they lose weight and just often die, not only from the burns, but from the consequence of the burns, the weight loss. So there's more lean muscle weight, and the burn reepithelializes. There's more new cells covering the surface in a burn wound when you give this association. Let me tell something about the long-acting IGF-1 therapy, which is one of the products. So IGF-1 is also called R3. It is a little longer structure than IGF-1. The dose you need to give, I estimate, compared to the IGF-1 that I usually use, that I have in the pharmacy here in Belgium, it's about 10 times lower. And you see here, this is actually the molecule of IGF-1, and this is the attachment to it. It's a longer molecule in position R3, position 3, and this has so there's a 13 amino acid extension. And basically, it has a longer life. It is around half-life around the 20-30 hours for that is much shorter with IGF-1. There's also another one that is a peptide that is the Mechanogrowth Factor. When you have Growtomon, Growtomon stimulates the protein synthesis inside of the muscles by stimulating local growth factors. And one of those, if not the main one, is Mechanogrowth Factor. So that has been isolated. And in order, because it's just short-lived for 2 or 3 minutes in blood, it is attached to a longer molecule, and that the whole complex is called pegylated Mechanogrowth Factor. And I tried it, and it seemed also to have a similar effect as IGF-1, giving you the power back. So then we'll have a session 4 and a session 5 where we'll talk about problems with growth hormone treatment and beneficial effects on disease. And you see, for example, that you have how to manage growth hormone overdose, how to manage persistent inefficacy of growth hormone treatment. And I can tell you a lot about that because I get a lot of problem patients. I consult regularly with patients. I don't see so many patients, but when I see a patient, it's to see him very extensively. So I like to have the difficult cases or where I can go much further in treatments with a 2-hour, 2.5-hour consultation. Cortisol deficient patients, growth hormone effects on physical appearance, on fitness, on depression, memory. So you found the studies before and after in a very easy to understand way, so that you know to what extent the growth hormone can help a person with such a disease. Traumatic brain injury, obesity, diabetes, sarcopenia, that's muscle loss, bone loss, etc. So here's the number one, in my experience, the number one physical sign of growth hormone overdose. After 2 to 10 days, there's swollen feet. And so if the feet is not just sort of fluid, it's too tense, it's like it's too rejuvenated, or that's a growth hormone overdose. That's the first sign that generally appears in most patients. And when that is, you need to back off with the dose, stop 1 or 2 days and take a lower amount. So this is usually the first sign of growth hormone excess. And then, for example, on depression, these are patients with proven and untreated growth hormone deficiency. And you have here 18 patients with adult onset growth hormone deficiency. 61% of those patients had atypical depression. So 61% were depressed. Adult onset growth hormone deficiency is a growth hormone deficiency that starts in adulthood. When you compare to those who have a short stature and start the growth hormone deficiency started in childhood, they usually have no atypical depression. They're used to their situation and they have no loss. They had not much growth hormone, so they continue with not much growth hormone. They tolerate that. But those who had a lot of growth hormone and were grown up as adults, they don't tolerate the change because they have a too big body for the low levels they are starting to secrete. And in the same study, you had, I think it's the same study. You had in a double-blind crossover placebo-controlled trial, growth hormone was given for 4 months to all the patients actually, and then there was also placebo period where they received that. Well, when they received Growtomon after 1 month, there were significant improvements in emotional reactions, felt better. They also isolated less. Growtomon makes you more open to see people. Otherwise, you isolate yourself when you don't have enough because you're too anxious, you're too stressed to see other people. And after 2 months, there's significant decrease in depression rating scale scores. After 2 to 3 months, the energy level starts. So there's a sort of gradual improvement. It doesn't all happen after a week. It takes time to improve. And some psychological characteristics are quicker improved than others. So we'll see that in detail so that people who register for the model learn really all the different steps that happen. And there's also less sleep disturbances, but that can take 2 to 3 months too. And also Growtomon treatment improves the quality of life in traumatic brain injury. This is actually a meta-analysis that is a series of studies taken together and that have been examined in patients who have had a shock on their head and had mild to moderate to severe traumatic brain injury. And 255 of those 264 patients were considered to have Growtomon deficiency confirmed by lab test. And these are 12 studies actually. And where Growtomon was given to these patients. And regardless of the coma they've been, Growtomon had a marked increase of quality of life and also improved memory and things like that. Now, when you look at those individual studies, they show even often more marked improvement. They tell that almost everything improves. People get less hostile, they get less anxious, they have more energy, they can do more things and things like that. So it's really worth to review the literature, but I will ask Mark Gordon, who's the expert, much more than even me, to give some more information about that. And also decrease the depression severity, etc. So these are really, it's an important stuff. Psychiatry should be with hormone therapies. Many of those patients that are in psychiatry need hormone therapy to get out of their psychological disorder. Here, for example, for memory, this is a study where actually the serum IGF-1 levels of those hypertensive old adults that were above 118 micrograms per liter were actually this the temporal horn, this temporal horn here, and that's actually a space where liquid, brain liquid comes, cephalospinal liquid fluid, and those who have a level that is above 118 are okay for their memory. They have good performances, and the white of the temporal horn is good. But those who have an IGF-1 that is actually below the 79.4 micrograms per liter are associated with cognitive decline. And so that's a low level. And you see this atrophy that actually is atrophied here. And this is the atrophy of the tissue. And this is the temporal lobe that is, this temporal lobe is atrophied and temporal horn is bigger. You see, this is bigger space because it takes a space where there was active tissue. And so that is associated with less memory and this bigger widening of the temporal horn. So when people have a level like this, you should expect that there's a brain atrophy actually, and especially in areas for the memory. Medial temporal lobe atrophy. Also for the memory, for example, for Growtomon was given for 10 years, it showed that after 6 months, it improved the vigor and decreased anxiety and tension. After 1 year, the memory was improved. So memory is improved lately, not the first thing to improve. After 10 years, there was still a maintenance of the energy, the memory, and lower anxiety and tension. Now, in my experience, when I took Growtomon, every year I was better, had more energy, slept better. And so I estimate that during 4 to 5 years, every year I was keep on improving on lower and lower and lower dose, because I became even too responsive to Growtomon. So I had to lower the dose to very small doses actually, and I was still improving. So there's also a relationship between the mood and the serum IGF-1. So the higher the IGF-1 is, the better the mood is. Also, there's with Growtomon and meta-analysis shows that Growtomon decreases the fracture risk because it strengthens the bone. So these fractures are less occurrent. It doesn't have significant effect on bone density of the lumbar spine, total hip, and femoral neck in these meta-analysis. That is, I think, wrong, because I found many studies showing, and good studies, showing improvement of the bone, but not the first 6 months. So if you do a trial the first 6 months, the bone density decreases actually, because the bone enlarges. And after a year, the bone densifies. So you shouldn't take studies that are short term, like 6 months or 8 months in this sort of meta-analysis. That's an error. Okay, so beneficial extended disease, some more effects are seen on atherosclerosis, myocardial infarction, immune system, cancer, longevity, and things like that. So many studies. I'm not going to see many of those studies, but show you one on with stroke. Stroke is this sort of hemorrhage you can have in the brain, or a lack of blood in the brain. And 2 respective studies showed that those who have growth hormone deficiency have 2 times more risk of stroke if they're not treated. And IGF-1 deficiency on mortality. So you see here, there are many studies, I think there are more than 20 studies showing that the higher IGF-1 levels are, the less risk you have of dying. So these are studies show you that if per 100 nanogram per milliliter increase of the serum IGF-1, you have 30% decrease in mortality. And here's 30% decrease in mortality too. And then you have one where also that shows these higher IGF-1 related to less risk of dying. But this in heart failure patients, in older stroke patients, in older adults, it's a constant phenomenon when mortality is examined. There are some studies showing the opposite, but that's a 10% fraction or even 5% fraction compared to the studies that show actually beneficial effects. And so here are some of the studies you see: association, higher IGF-1 levels associated with more there's more longevity. Again, other studies, and but here's here are some of the studies showing that you live longer when you have low IGF-1 levels. It's quite paradoxical. There are some explanations that I can explain, but basically it could be just a bias. And so when you give growth hormone treatment, what happens? Well, this is a series of hypopituitary adults that did not receive growth hormone, so they had 2 times the overall mortality, except deaths from cancer. And in adults who receive growth hormone therapy, so it's the same person who received aggregate growth hormone treatment, you see the change in face. They had a decrease in overall mortality that was very beneficial. And so we'll see also in this model patient cases with growth hormone IGF-1, and then we'll talk also some about in an additional presentation that won't be in video, but you do have the handout, the PDF file. And we'll see many of the very important controversies about diagnosis, how to legally prescribe growth hormone. Does growth hormone decrease the growth hormone secretion by the body? Is it just a short effect, or does it cause diabetes or heart disease or premature death or cancer? All the anxieties you could have on Growtomon are really treated, and I can tell you it's reassuring. And let's see one of those things: how to legally prescribe Growtomon to adults in the United States. All you need to know. So FDA was interviewed for what is possible in the United States, okay? And the lawyers asked that. And well, basically what they said is that you cannot use Growtomon for any other thing than a disease that is for which it's authorized. So this is Growtomon treatment can only be used for treating Growtomon deficiency. So if you treat with Growtomon in the United States, you need to treat Growtomon deficiency, not for rejuvenation, for example. That's not an indication. Or you treat a child for short stature, for Wiley-Prater syndrome, or childhood renal failure. And when you look at the package inserts also, before you were required to do a Growtomon stimulation test for a diagnosed adult Growtomon deficiency. Now, not so much. In package inserts, for example, you have actually, you need to do serum IGF-1 concentrations. So, and look at the patient's clinical response. So it's more freely to prescribe Growtomon and to make its diagnosis of Growtomon deficiency. So what you need to know about Growtomon is that this is the only drug in the FDA that should not be used off-label. And you need to write the diagnosis of Growtomon deficiency on the prescription. So you write, for example, for treatment of adult Growtomon deficiency or for short stature. So, for example, when you have this paper, for example, this is one of the pharmacies that's University Compounding Pharmacy is in California, in San Diego, knows a lot about. So if you need to have more information as a physician or even as a patient, go to that UCP pharmacy. They know it even better than I do. But you need to write the diagnosis on the prescription. So you write here, adult Growtomon deficiency, okay? And then you need to sign, of course, to sign here. And that's the best way to do it. So UCP is one of those pharmacies that knows a lot about it and has sells the Growtomon. Now, Growtomon treatment also can reduce overall cancer. So here we have a study where untreated Growtomon deficient patients were examined, all had a higher cancer rate. So when you have a lack of Growtomon, you have a higher cancer rate in adults. In men, 1.5 more, in women, even more, 2.3 times more. Now, if you have another group of more or less similar patients that have Growtomon deficiency, and this is a study in Sweden, and they had received during 5 years Growtomon treatment, they had a reduction of cancer rate. So it was normalized with the Swedish population. They even had lower, slightly lower, but not significant cancer rate compared to the normal Swedish population. And men had there's mainly women who had much less risk actually of cancer with it, and they had the highest risk when they were not treated. So it's really a very good treatment that is safe if you give the right dose. Of course, you don't need to give 10 times the dose. Now, also interesting is to note that patients with acromegaly is a disease where they make too much Growtomon, and you have a extension, the mouth, the chin becomes too large, the hands become too big, the feet become too big. And this acromegaly, there's a 24% decrease in overall cancer rate in these patients. This is a study in UK. And they did have more colon cancer, but all the other cancers were less. But they did also have more cancer mortality because those patients are more fragile anyway. But what is really interesting is to know that it does extremely high amounts of growth hormone they make does not cause cancer. So here we are. Our next events will be a free webinar that is on Tuesday, June 14, and we'll talk about fascinating psychological and psychiatric disorders and hormone therapy, including psychosis, anxiety disorders, depression, and low stress resistance. And we have a medical education part, and this is the evidence hormone therapy postgraduate program that I'm making here. And when you look at here, for example, the first cycle talks about COVID, about inflammation and inflammatory disorders, about reversing physical aging. That is our most sold model. As an individual, you can buy one model or several models or the whole series, which is better price. And then you have female hormone supplementation, chronic fatigue and burnout. I can tell you, I think this is really exciting. For me, all the models are exciting also to have made them. Thyroid diagnosis and treatment information like you probably never would have had. You have on Hashimoto's disease, also autoimmune disease, hyperthyroidism and others, melatonin. And each time we have normally a physician interview that is an expert in the field, that sometimes also make the lecture, testosterone in men, testosterone in women, etc. And there's also a hormone therapy in cycle 2, hormone therapy consultation program that's very, very good. And then you have the adrenal hormones and things like that also as models. Now, I'm going to interrupt here because we're going to see Dr. Mark Gordon and interview him, and then we'll answer also the questions together with him. So let me see here. Mark, can you put your audio and your video on? Perfect.
I'm back. Hold on.
Very good. Perfect. Yeah, sure.
Okay. That was a lot of information.
Yeah, it is. I should probably go a little slower, but I was hurrying to be able to interview you and get the questions. Mark, normally I'm a little bit, I have other people that have put their video on. I don't know how to get them out. I'm going to see, but no, I don't think it works. So we'll have to do the small screens. I don't know. My team should have arranged that. Mark, I think you're, when did you start first with Growtomon, and what was your experience then?
My personal
your patients,
my
yes.
practice experience.
The one you want to talk about.
Well, in my practice, my practice, I started using growth hormone back in 1995. And at that time, I was working with people who had injuries. So I did an ESPN Outside the Line, which I think I sent you in 2006, talking about why our football players, American football players, didn't heal well. And that's because the importance of growth hormone in regulating repair. And part of that repair is sugar metabolism, protein metabolism. We talk about growth hormone, but I think we fail to look at the 9 other proteins that are generated by growth hormone in the liver, IGF-1 being the most important one for general body. And it also stimulates protein synthesis and repair. And that's some of the benefits of it below the neck. Above the neck, in Alzheimer's patients, we see that their cells die faster because they don't get the sugar, because they don't have growth hormone that helps to get the sugar into the brain. As you, when you dissected the molecule, the 191 amino acids of the growth hormone, it has these important little areas on it. The AOD 9604 for helping with fat mobilization. We use it. Okay. So
those football players are they heal better with it.
Correct.
So tendons and our joints and things like that. Because I know one of my patients is a veterinarian, and he started using Growtomon to repair all those high competition horses, and actually he said it was miraculous. It really improved because they usually don't have good treatments for it or not sufficiently good. So he was very enthusiastic about it. And I know my daughter, India, is a veterinarian now, and she made her thesis on IGF-1 and tendons. She probably knows more than me about it now.
Yeah, when you mix the peptide BPC-157 with the growth hormone, it accelerates the healing of tendons, ligaments, and muscle. So it works very well. You know, we have all these peptides available to us.
Yeah. What is BPC? What does it stand for?
BPC-157, it comes from the gut. It's a segment of it. It just turns out to turn on the repair of tendons and ligaments.
Great. I think there's other ones like thymosin beta 4 and
thymosin 4 beta or thymosin 5 TB500. There are hundreds of incredible peptides coming out.
Now, Mark, you actually devoted part of your life and your work on traumatic brain injury.
Yes.
Can you tell more about it? What motivated you? What was the reason?
Sure.
What is your approach? But then shortly, because we won't have time to make
my rationale behind it was in 1997, after 6 head traumas that I had myself, I developed depression and wasn't very happy in life. And one of my escapes is to read. So I was reading about the area of hormones relative to brain function and found in some important articles, one that came out of all places, Turkey, and pugilists and boxers, was that repetitive head trauma in boxers led to growth hormone deficiency. And I looked further and found all hormones are affected by trauma. So I started diving deeply in 2004 into the relationship between hormones produced in the brain. And that's why I don't do endocrinology as much anymore. I do neuroendocrinology, which deals with the brain's unique production and use of hormones that regulate our personality and our cognitive ability. So we see improvement in Alzheimer's, in Parkinson's, in ALS, in depression, anxiety, bipolar, obsessive compulsive, as you were touching on at the completion of your segment. It is very, very important, all the hormones, not only growth hormone, testosterone, DHT, DHEA, all those hormones in regulating an optimal chemical balance, hormonal balance in the brain, so we function. Try driving a car without gas or petrol. It doesn't work. You need to put the right petrol in.
And I was questioning when you were talking, also I had interviewed you a little bit before. Is there not something like traumatic brain injury due to stress, actually,
yes,
without any shock? Because
correct,
it looks sometimes similar. People have been tremendous stress. They react the same as traumatic brain injury, with this labile emotions, this dramatizing, everything's too much for them.
Absolutely. That is caused by a chemical that we found in the brain. It's part of the immune system that they call chemokine. It's like leukotrienes, chemokines, and cytokines. These are chemicals produced by our immune system under stress. Cortisol goes up. Cortisol shuts off a protective protein called fractalkine. Fractalkine keeps the brain calm. But when you lose that under stress, you get inflammation of the brain. And all the issues that you were talking about, from my standpoint, are all precipitated by inflammatory processes, and growth hormone helps to settle it down. And the improvement in sleep, in pain, in cognitive disturbances, and emotional volatility is all induced by this inflammation, changing the ability of our brain to make serotonin, adrenal, acetylcholine, norepinephrine, epinephrine, all the neurotransmitters. So that's why we use things like SSRIs, which don't work in the most cases. Like you talked about.
Made people zombies. When we had secretaries, we had to fire them when they were on antidepressants because they made so many errors. It makes you another world. It calms down probably your anxiety by making you a zombie, but that's not what we doctors want to do. Huh? And then you have a method that you privilege first reduce inflammation before you give the hormones, if you can do that, of course. And so what are the lines that you would propose people that are listening to tackling inflammation? What are your main lines?
At the outset, the most important is the proper laboratory testing. We do a laboratory testing that includes what we call neurosteroids, the hormones produced in the brain, and neuroactive steroids, the ones that are produced by the body. And we look at the array of them because the brain controls the ones below our neck and controls the one in our brain. And we look for the markers that show that it's off out of balance, like prolactin and luteinizing hormone and follicle stimulating hormone, somatostatin. I mean, there are things that we look for, IGF-1 and growth hormone, and the patterns tell us where the problem is. And then we can start by addressing the hormones and addressing the inflammation at the same time. We have a project going on where we just address the inflammation.
And how do you do it concretely when you address the inflammation? What basic lines?
Well, what we have is a group of products that we developed over the past 16 years, which are nutraceuticals, and they're delivered into the body through a system called liposomal, so it gets absorbed rapidly. And what happens is we see over time improvement in their psychiatric and cognitive complaints. The most rapid response is, I'm feeling clearer in my brain. And we've reversed 3 cases of Alzheimer's now, where one of the gentlemen, 72 years of age, is now in the gym 3 days a week with a trainer. His wife is the monitor and tells us that he's now happy, he's communicative. We've got a 66-year-old woman from one of our veterans who was sedentary. She just sat all day, wasn't able to communicate. If she talked, it was gibberish. And her son says within 7 weeks, she is now working around the house and talking clearly. And that's because the chemistry that our brain needs does not work if the inflammation has changed the chemistry. That's what people don't understand. It changes the chemistry.
And you do that only nutraceuticals, or you combine it with the hormone therapy to be
we use nutraceuticals and hormones. Okay,
So,
we have a neuroinflammation aspect and we have a hormone replenishment. Hormones, very, very important.
And in the nutraceuticals that you give, I think you give an acetylcysteine in high amounts, I think, and
we use we use quercetin, we use N-acetylcysteine, we use glutathione, gamma tocopherol, what is else in there? PQQ, CoQ10, because they upregulate the function of the cells, the mitochondria production of ATP. You need energy to run the cells. How is energy produced? You need glucose and you need the right B vitamins to help the mitochondria work. You need functional mitochondria.
And I suppose you have to give it several times a day, not just once.
No, just in the morning. We did a study with the military. Once in the morning, our packet called Brain Rescue.
It's a package of antioxidants and that are also anti-inflammatory, more or less. Huh?
Antioxidants and natural anti-inflammatories. When you mix, quercetin is incredible at lowering inflammation in the brain. And we know specifically that it's NF-kappa B. We know when you mix N-acetylcysteine, it lowers NF-kappa B. So it all drops the inflammatory chemistry. Ascorbate palmitate, a form of vitamin C, very good at upregulating glutathione in the brain and removing free radicals. That's the problem.
And I suppose you also improve the food that don't
Correct.
Eat junk food and things like that, like we've all learned.
Yeah. My daughter Allison is the naturopath who takes care of all our civilians, but she takes care of all their gut brain through nutrition, their colon, good exercise, good hydration, good food, meditation, good hormones, and anti-inflammatories. Those are the 6 or 7 corners of our treatment.
Yeah, I know that meditation increases Growtomon and increases DHEA and decreases cortisol, but increases when you need it. So I think meditation is of course, very, very important. So you do a whole holistic approach.
Yes,
I understand. And good. Is there, do you have a treatment for post-COVID syndrome or for COVID syndrome or for post-vaccine syndrome? I think you have some new ideas there. Are you?
I started writing about COVID in in April of 2020 on my website, there are 3 papers that were published, which are called in defense of COVID-19. One of them talks about anticipate neurological problems. And that was in May of 2020, to anticipate neurological problems, which might be cognitive, which might be physical, which might be emotional. And that's all due to these inflammatory chemicals that COVID-19 or SARS, all the SARS, influenza creates a overwhelming amount of these inflammatory chemicals in the brain. So at the website, there's a paper called Long COVID that talks about 2 of my daughters and the treatment we used on all our patients to address COVID, the symptoms, long COVID.
To easy find your website, they put Dr. Mark Gordon or Millennium?
They can do that. It's tbihelpnow.org. Okay.
tbihelp.org, and TBI
Help
is
now.
traumatic brain injury.
tbihelpnow.org, or they can put my name in it. It'll come up.
Okay,
So,
and your name also. So that's good.
that should help.
So basically, you give general information about the COVID, but if you get the COVID, for example, would you increase something in yourself, and you would advise also to others to do?
Well, in one of the papers, I talk about quercetin and zinc. Quercetin carries zinc into the cell. Zinc stops the virus. Also, in the United States, we have a product which is called CPD, which is a byproduct of marijuana. I don't know if it's in Europe, but what they found that is it there?
Yeah, they have special shops now that sell it.
Okay. Well, what CPD does is it blocks a receptor called the ACE2 receptor, which stops COVID from getting into your cell. If you can stop COVID getting into your cell, or if you can stop the COVID once it gets into your cell from replicating, that's how you stop it. Okay. I've got lots of patients who haven't gotten the vaccine and who are on quercetin and zinc, vitamin D, and glutathione, and then a medication if they're at high risk called Amantadine, which has not been used. They talk about, ivermectin, they talk about other things, but there's a secret product, which is Amantadine. And how Amantadine works also as a side, it increases growth hormone production. But that's not the focus.
Oh.
It's an antiviral drug.
That I didn't know.
An antiviral drug that came out in 1966 by DuPont. And I've been using it since I did neurology. It was the first treatment for Parkinson's.
And it's relatively safe, I suppose.
And I've been on it for, since 1984. I don't get sick.
What is the dose that you're taking, for example?
100 milligrams a day prophylactically. And if you get sick, 100 milligrams 3 times a day for 4 days.
And so with that, you don't get the flu, you don't get any virus infection.
It's antiviral. It works on influenza A, B, SARS 1, 2, 3, 4, 5, 6, 7, 8, 9, rhinovirus, and enterovirus, because they all have the same necessity of lysine. They all are lysine dependent. So this blocks lysine.
Lysine. Okay, good. On Growtomon, let's go back to Growtomon. Can you relate maybe an experience with 1 or 2 patients that really marked you, the difference, the change, that something that you saw that this patient was much better, much happier, or something special?
Yes, you touched on it. There was an article that came out from, I think, University of Birmingham in England in 2017, talking about people who were resistant to treatment for depression, atypical depression or treatment-resistant depression. They found, as you said, 61% of them had growth hormone deficiency. Within 1 to 2 months of putting them on growth hormone, their depression disappeared or reduced significantly, and they ended up with 4 benefits. They slept better, they had brighter minds, they had better interpersonal relationships, and they were less emotionally volatile. And I see that day in, day out with, I take care of military, I take care of veterans who have been exposed to blast trauma. And in this population, seeing their depression disappeared, they're becoming better people socially, that is one of the joys that I have. And the other one is people who have had orthopedic problems. and the traditional approach for orthopedic problems doesn't work. On that ESPN Outside the Line that I referenced from 2006, talked about orthopedic problems in sports people who weren't getting better. You correct their level of growth hormone, you see them getting better. If you just spend 14 minutes and watch that ESPN Outside the Line, you'll hear from our patients that are all professional, very popular baseballists, football players, and so forth, and how they got better. They got their full range of motion back. Those are the keys. Without the brain and without the physical functioning, it's tough to live.
Yeah, and there are many people out there that actually are not treated because they don't know about it or they're just afraid of taking. So what would you say to them if they say, look, I'm afraid it would give me cancer or it would give me a heart disease? What would your answer be?
One of the things, yeah, I agree with it. It doesn't. And one of the lectures that I did was on the myth of growth hormone causing cancer, because they stop when they talk about growth hormone causing cancer, they stop at what growth hormone really does. Growth hormone turns on 9 proteins in the liver, 2 of them called IGF binding protein 3 and IGF binding protein 4 are anti-cancer. One of the greatest studies that was done on binding protein 3 was out of Melbourne, Australia, called the Melbourne Collaborative Study. And they found just by increasing the IGF binding protein 3 by 28 millimoles, you had a 48% reduction in colon cancer death. So it improves it. And the mechanism, I ripped the mechanism apart because I go to the molecular level. I enjoy the molecular chemistry. And in the molecular level, it shows how IGF-1 binding protein 3 stops the cancer process. And if it can't stop it, the cell is killed. So it doesn't propagate, so it doesn't replicate. So I've never had in any of our thousands of patients on growth hormone cancer. And as you showed in those articles, I watched everything. I had time to watch everything. It was really good. It was very broad. And you have to understand that growth hormone does not cause cancer. Testosterone doesn't cause cancer.
Yeah. So we're always fighting against prejudice, but the data is there to support what we experience also. So that's very good. I'm going to now to go to the questions, and here maybe you can answer that. It's in French, but I will say it in English.
Something about augmenting the growth hormone production.
Yes, the growth hormone production, could it stimulate a pituitary adenoma, tumor?
Can stimulate only if you're predisposed to it. You know, I don't see in the thousands, we've got, 3,500 patients. I only have seen maybe 4 or 5 pituitary adenomas that came in, and there were prolactinomas.
Yeah.
They're more common prolactinomas,
Yeah.
not growth hormone.
I can answer you the question. There's a meta-analysis that was published lately of several studies, and it showed that there was no increase in risk of a pituitary adenoma with the use of growth hormone. That was done because many patients who are treated with growth hormone have had a pituitary adenoma that has been removed, and there was no increase in recurrence. And then here, why could it be a difference between glucagon and growth hormone releasing hormone arginine test? Do they measure other parts of the brain? So it's the diagnosis of growth hormone is based on stimulation tests in some hospitals. But I don't think you should care much about what you use, because it's not really a very efficient method. It's a method important for reimbursement for the growth hormone, but it's not a method important for treatment. I think it's better IGF-1 and IGF-BP. What do you think about the diagnostic tests?
I think they're generally worthless, except for the IGF-1 and binding protein 3. And that's because growth hormone in the morning, when we draw it, it's the lowest. So it's unreliable for telling us what's going on. Binding protein 3 is probably the most reliable because growth hormone causes the liver to produce the binding protein 3, and it has the longest half-life of 20 to 24 hours, where IGF-1 only has 8 to 10 minutes.
Yeah.
So the most reliable is binding protein 3, but I use it with the IGF-1.
Yeah. Here, this patient who had a relatively higher test with one of those tests with growth-releasing hormone and had a lower test with glucagon, which are both stimulators.
Right.
When you look at the levels, those are very low for both of the tests. So it normally would give a reimbursement with the lower result, and the higher result might not give the reimbursement, but it's still too low for a no. So this patient should follow the treatments that we do, and it's only if she wants to have reimbursement that she has to use the test that shows better results for her to get reimbursement.
I saw the question where someone asked about how to naturally increase growth hormone. And as we know, low sugar, low fats, good physical activity can increase it. Also, there are a couple of natural products that can do it, like mucuna can increase the production of growth hormone. That's because it's dopamine. Dopamine will increase growth hormone production. So the best is good physical activity, high impact aerobics, low sugar, low fat.
Yeah. Here's an important suggestion is a patient says that he went during 1 week on growth hormone and felt wonderful, no exhaustion anymore. And then suddenly the lungs started to go bad, like an allergy, sort of asthma. And basically, I know what I think happened, but is that this patient had the growth hormone lowers the cortisol. And it's, for me, relatively dangerous to start in a patient who has adrenal deficiency and is not treated for the adrenal deficiency to give growth hormone because of this lowering effect that is 20 to 40% lower. And that's why we usually use IGF-1, which has an opposite effect. It improves the cortisol levels. So this patient, actually, I had 3 experiences that marked me for life. Is that I had 2 patients saying I had the flu, like I never had. No, one had the flu for 6 weeks, like never before. One had a bronchitis for 6 weeks, like never before. And one had pneumonia, lung infection, also for 6 weeks, like never was happened. They felt terrible. And actually those patients were on growth hormone, but their adrenal deficiency was not treated. And since then, I can tell you, I treat all the cortisol deficiencies I find with the DHA, otherwise, in order not to have these problems. And I never had any problem of that sort. But usually you need to give cortisol to people who are borderline low cortisol, or they collapse with the growth hormone. So that's the reason.
Right. An interesting thing that you were talking about in your lecture was about the overdose of growth hormone leading to swelling of the feet. And I found in my population here in California, they like eating sushi with lots of salty soy sauce. So what I found in my population, those who were put onto growth hormone, if they ate a lot of sushi, they had swelling. Well, it turns out that growth hormone has a 2-phase effect in the kidneys. First, it absorbs sodium and chloride, salt, and then a week or 2 later, it'll diurese. It'll cause you to urinate out. So what I tell all my patients going on to growth hormone is don't eat salt. Because they'll get swelling of the hand. Yeah. So sushi.
It's a good suggestion. I also sell, if they swell, first they take potassium to kick out the salt. And if the potassium is not sufficient, it's a fantastic diuretic, potassium, and take 1 to 4 grams. And if it doesn't help, then they have to lower the dose. But I maybe have forgotten to ask them to lower the salt, because the potassium works by kicking out the salt. So that's very good suggestion.
Do you have a timing for injectable growth hormone? Do you have a preference on the morning or the evening?
Yeah, it absolutely has to be in most people in the evening for one reason, is that otherwise it lowers the cortisol production during the day. And at night, it's a healthy effect. So what I always say to the patient, we have to mimic how nature works. Absolutely. And nature works, does a peak. And there are a few exceptions. I think I had maybe 2 or 3 patients where I had to put it in the morning, because if they took it in the evening, they couldn't sleep because it activated the thyroid function. But that's exceptional.
Yeah. Well, in the literature, that growth hormone can cause a rapid conversion of T4 to T3.
Yeah.
So that T3, if they're one of those people, they'll get at nighttime, they'll be up and ready to run a marathon. So
Yeah.
it's uncommon. I don't see it, but it happens. I see it on the blood flow.
Yeah. Also, the question that was in French, to stimulate growth hormone production naturally or without hormones, one of the ways that works in each age is to give glutamine. You have to give at least 2 grams. The 2 grams of glutamine helps. The other don't work so well in people who are older than 30 to 40 years, in my experience at least. But the glutamine is something that can work in also older adults to stimulate the declining growth hormone production. But you need to take it before bedtime then.
Arginine can also help because taking it for a multitude of reasons, but arginine blocks somatostatin. So you can get a higher natural production of growth hormone. You're not suppressing it.
And so, what is the dose of arginine?
It's 2 to 4 grams at bedtime. The added benefits of arginine is it helps to diminish platelet stickiness, improves insulin metabolism.
Good. Okay. Perfect. Our question, you can answer that if you want. It's our levels of 113 nanograms per milliliter too low for IGF-1 for a 30-year-old female?
Depends on what time of her cycle it was taken. Because what we see is women who have high estradiol will push their growth hormone level up. I see it more commonly in women who are on birth control pills, young women. They'll have crazy high levels of growth hormone. And it turns out that estradiol is very important in the brain for stimulating production of growth hormone. In the liver, growth hormone and estradiol increases IGF-1 production. So you have to look at a broader information.
Interesting. Yes, it's true. But for me, 130 nanograms per milliliter for an average size female is generally too little, although I need to have the IGF-BP3 to be sure. If you have a low IGF-BP3, it could be enough, but if you have an average or high IGF-BP3, it's generally insufficient. There's not enough getting into the cells.
Also, also certain medication can influence the production. Like we have an issue with clomiphene citrate, which we use a lot in our men to generate natural production of testosterone. It has a selective effect in the liver of lowering IGF-1 production. So when we see elevation in testosterone, we usually see a lowering because it blocks the estradiol in the liver. Growth hormone and estradiol, very important for stimulating IGF-1.
Yes.
Growth hormone.
And one of the reasons why testosterone helps to stimulate growth hormone is that it converts to estradiol. Because if it converts to dihydrotestosterone, which is a metabolite of testosterone that gives the body here, then it cannot, and the IGF-1 is even lower and growth hormone is lower. So it has to convert to estradiol. So estradiol is really the hormone that stimulates IGF-1.
Correct.
And
estradiol, I don't chase estradiol in my men patients because it is so important for growth hormone in the brain, IGF-1 in the liver, neuroplasticity, protection of the heart, the lining of the arteries, protection of the bones, also libido. You can't have, if you have a male has great testosterone but low estradiol, his libido will be off. And in women having the opposite way, they need testosterone with their estradiol. So also blood flow in the brain.
It's very important to have estradiol, but it's true that when estradiol is too high in men, they get bigger prostate hypertrophy, and they also have a lower libido. I have studies that show lower libido with high estradiol. But of course, it's always the balance. You need to be at the right level. And so that's good.
Hey, I don't like this. We're agreeing on everything.
Yes.
We need to be in conflict.
It's based on experience, I think. We're really working on patients. Right. Is there anything one should not do before testing IGF-1?
Drink a lot of alcohol.
Yeah, alcohol lowers growth hormone and IGF-1, and
in the brain and in the liver. Yeah.
And coffee. Coffee lowers growth hormone. I have studies. Why don't, but otherwise you can eat, and the IGF-1 is not influenced by the food. normally it's always better to do on an empty stomach a test, but IGF-1 is not influenced. What you need to do, and I always ask to all my patients, is that before they do a blood test, they drink half a liter of water, because otherwise they have dehydration and all the binding proteins are high and the hormones are high. So drink water before. And why don't people block somatostatin and give Growtomon, or use a Growtomon releasing hormone or Growtomon releasing peptide? So what is your opinion?
The reason why you don't want to block somatostatin, there are 17 forms of somatostatin, and it turns out they help our immune system. So if you totally block the somatostatin, you will hurt your immune system. This is why growth hormone works to help your immune system, because it actually causes somatostatin to rise. So it's somatostatin by the hypothalamus, which regulates a lot of the systems in our body.
And I was very interested. I think you have a laboratory that can test somatostatin and other things that we don't have in our laboratory, or not?
That's in Access Medical Labs in Florida.
Access Medical Labs can check.
Which you can send from Europe to them. We set up in UK. We set up a shipping in UK, yeah. Because now we're working with the military in United Kingdom.
Perfect, because Access Labs are really good people. Now, one of the reasons we don't work rather than with Growtomon, it's Growtomon releasing hormone and Growtomon releasing peptides, is that the results are short-lived, in the sense during 6 weeks, 8 weeks it works, you secrete, but there's only 2 milligrams of stock in the pituitary gland of a healthy young adult, and that depletes, and then it doesn't work after. Sometimes you need to stop a month or 6 weeks and then start again. So you cannot have as constant effect as with Growtomon. I think you also agree. I see you were nodding. So I suppose.
Absolutely. There was an article called Homologous Downregulation, which showed in a short period of time, Sermorelin, Ipamorelin, MK677, that since they're single channel stimulators, their receptors diminish because you wipe them out. So it's the receptors that are lost, in addition to the limited amount of growth hormone that you can produce.
Oh, so there's also loss of receptors. So that explains more. So you need a certain time to get them back.
Well, that's why when I use a secretagogue, I use one that has 5 pathways that it uses. Okay. So that it doesn't have homologous downregulation. I'll send you the article. It's an interesting article.
Here's good friend of mine, Phil Mycams, he says, hi, have you heard this before? But some claim that vegans have low cancer rate because they're typically low growth hormone. Would you care to? But I think the vegans have low cancer rate because they don't eat cancerous carcinogens. It's not the low growth hormone is an unfortunate effect, because apparently there are almost never a centenarian who is a vegan, because it does not permit to have all the food you need, because our intestines are not long enough to absorb everything. So you lack vitamin B's, you lack iron, you lack a lot of nutrients because you don't eat more omnivorous. There's a question. Growtomon is controlled in some countries like UK and can be difficult to use. Have you experienced with growth-hormone releasing peptides like GRP or GRP2 or GRP6? I don't have experience with those.
I lecture on them, and they are fractions of the growth hormone releasing hormone protein. And what they do is they stimulate the growth hormone receptors so that it would trigger the growth hormone production, GRP2, GR6, and they've got others. They have the same negative effect as Sermorelin, Ipamorelin, and MK677 because they're just shorter peptides. That's in the peptide world, they're finding the segments that do the same thing as the big 191 amino acids.
So also after a certain time, it doesn't work, and then you need to stop and restart later. System. Okay. Now, can Growtomon or IGF-1 be used for MS or ALS, amyotrophic lateral sclerosis?
Yeah, we have about 3 cases of MS that we basically reversed. Testosterone, very important for it. Growth hormone, very important for it. The anti-inflammatory regimen that we have is very important. And for MS, DHEA because DHEA
Yeah.
increases the cells in the brain that make myelin, the coating of the nerve, oligodendrocytes. It increases their production of the coating, and there are articles out there showing how it helps. In Parkinson's, testosterone, very important, and pregnenolone, because you upregulate in 4 areas of the brain dopamine production. They talk about only one area called the substantia nigra, but there are 4 areas, and as well as growth hormone increases the receptors, the DR2 receptors, dopaminergic 2 receptors, and testosterone increases them also and increases the amount of dopamine. So I have a gal flying in from Sweden who's been with us for a couple of years. She was off of Parkinson's about 70% better in 90 days. And that is, and she's flying back in now that COVID's allowing her to come back in from Stockholm, Sweden.
I can confirm that you can reverse Parkinson actually with Growtomon, so that works. I would be a little bit more hesitating for giving Growtomon to MS only. Why? Because Growtomon decreased the cortisol, and I had one patient who did go in a crisis when taking Growtomon because of the lowering of the cortisol. So you need to be sure that you correct the cortisol deficiency and maybe give. We rather would start with IGF-1, which has the opposite effect on cortisol, and I think might be safer. And IGF-1 has more studies of improving the nerves. So, but I think you can give Growtomon, give enough cortisol, but be careful.
IGF-2. IGF-2.
Are you using IGF-2?
I have it. Because it's more, if you look at the studies on IGF-2, during neonatal development, it's IGF-2, not 1. So if you're dealing with a central issue, IGF-2 can be paralleled with IGF-1 for additive benefits. So,
and is that available, IGF-2?
IGF-2 is available.
Wow. You send me the information.
I directed you to the company. You can go and read it.
So if we go on to your website, you have the information.
To the website I gave you.
Okay, the website. Okay, perfect. I'll note that. Oh, okay. As you know, or you may not know, but I think you know everything. Is that a child, a fetus who doesn't grow during pregnancy, is too small on birth, does not have a growth hormone deficiency. Growth hormone deficiency does not give a small fetus or small baby, but IGF-1 does give a small baby. So what I suppose is it's the IGF-2, not the IGF-1.
Yeah. If you look at the neonatal studies on growth hormone, you'll see that the development, in utero development, is predicated on IGF-2. It's more of IGF-2. It's still
okay. Well, interesting. I'm learning here. Very good. How can they get growth hormone and IGF-1 in Germany? We get in Belgium IGF-1 from Germany, from German pharmacies on prescription. Okay. And we get the growth hormone in the pharmacy, and it's also available in the pharmacy in Germany, but you need a prescription. That's all, and it's more expensive in Germany. For growth hormone, it's less expensive for IGF-1, but the firm that produces the regular IGF-1, the one doesn't want to sell it to adults. Only if the stock is almost perished, then they send us, then we have 2 or 3 months, then we can get it. So there's a little problem of the firm only wanting to give it to children who have difficulties to grow, and they have an overproduction that they sometimes lend to adults here. Is there a risk of antibody production or autoimmune disease with growth hormone or IGF-1? What is your? I think the answer is
if your immune system is sensitive, there's a possibility to get an allergic reaction to anything. So if you have a hypersensitive system, then yes, you could. I haven't seen it. Okay.
But again, I would say the risk is greater with growth hormone because it lowers the cortisol, which protects against autoimmune disease and allergies and antibody production. It's not with IGF-1. In my experience, we really have very good effects with it. Patients with high level of insulin, what to do? Does the Growtomon increase the insulin? I'm not sure to understand.
No. We have diabetics, type 1 and type 2 diabetics. We've reversed 23 type 2 diabetics with a protocol, but the type 1 insulin dependent ones have had a 30 to 40% reduction in the requirement of insulin with the use of growth hormone. Why is that? Because IGF-1 crosses over 10% as an insulin. So it actually works like insulin without the side effects. It doesn't bottom you out.
Okay, well, because the literature says that insulin requirement, there's less hypoglycemia with Growtomon in these patients with diabetes, but there is a more insulin requirements, up to 75% more, but they do better because they don't have hypoglycemia.
Yeah.
But with IGF-1 has been given to diabetic patients, and there it's perfect. There it decreases the insulin requirements. So it depends on the amount of IGF-1 they produce. But I think if you had that good experience, I think it's because you decrease the inflammation much more, and the liver produces more IGF-1 with your patients, because that's a possible explanation, because you're very focused on inflammation, which makes that you relieve the body from something that would decrease IGF-1 production.
Also, talking about growth hormone causing insulin resistance, it's dose dependent. So if you use too much of it, you'll get more fat liberated, and that fat will block the insulin. So if you modify your levels, so we always use a low dose regimen. Very rarely do we use high dose. Where do we use high dose? In orthopedic injuries, in healing, preoperatively, postoperatively, we'll use higher levels. But for the average person, we use low levels, like a half a unit of growth hormone. Yeah. Most people use a unit, 2 units for whatever reason. My body,
absolutely. And there's a study that shows if you use 0.1 milligram rather than 0.5 milligram, you improve the insulin sensitivity a lot. That's 0.3 international units. Last question, because then after we have to end and things, is something about birth control pills. Do they have to supplement with more hormones if they take the birth control pill, especially Growtomon IGF-1? Does that be additional supplemented because the birth control pill increases the binding proteins of Growtomon and IGF-1? They have to, actually. I think they do.
Well, we know that birth control pills, they do a couple of nasty things to the body. I have 3 daughters, so I'm telling you from experience, not only with all the females that are in the practice, but my daughters. Birth control pills will shut down testosterone production. So that will influence their personality, their cognitive ability, their libido, their enjoyment of life, their memory recall, the ability to learn new things. And also because the estrogen part of it suppresses your estradiol production, you'll see a reduction in your measurable estradiol level because it's been substituted with this synthetic artificial form of estrogen. So what I tell my female patients, as well as I told my daughters, get off the birth control pills. They really muck up the entire hormonal chemistry that influences your brain and body. That's my
great. Really, I have a lot of thanks for you, and I'm grateful. I think people are very excited about the webinar, and thanks to you, it has been even greater than January. So we'll stay in contact, I hope. It's really good, and people who are listening, they know they can just put your name and they will get onto websites where we'll get a lot of information, and much more than you have given here, because Mark Gordon is very generous on information. So it's really worthwhile and it's good information. So thank you. I'll have to go a little bit back in the presentation, but let's keep in touch. Thank you, Mark.
Will do.
Thank you. You can cut out your video and your audio. And so I have some more announcements to make. Is that we have medical education, and up here is that there's a special offer on everything on the Hertoghe Medical School that you get. You get a lot of information on neurodegenerative diseases, on simple diseases, on how to do hormone therapy and how to have nutritional therapies, improve the hormone therapies. So there's a special, use this code within the code, and you will get this 20% off. These are the books that are really important if you need to have the basic book, the best book. The one book is the Hormone Handbook to buy. You find everything about 18 hormones, therapies, and 18 hormone deficiencies. Atlas is really accompanying it, and Reversing Physical Aging is really a very thick book. It doesn't show up, but it's much thicker than the others, with a lot of information that is useful if you want to reverse aging with nutritional therapies and hormone therapies. And if you want to join the program, I really propose you, because it really will be helpful into your practice to do this. And I think the information will never forget that is in it. So you have all these different things, the models that we talked about, and here are all the firms that have helped us so much, are really our major partners. We're really thankful for them for helping us. Here's you always talking for Hormonor.
I'm Joe from Hormonor Belgium. First of all, I want to thank Jerry and Claude and their team for the tremendous work they're doing with their movement towards more prevention and better health for all. Hormonor is one of Europe's largest producers of very high quality food supplements and is active in 45 countries. We have more than 400 studies who are conducted with the final products of Hormonor. Lots of universities use our products because of the unique level of bioavailability. Besides our Q10, the bioactive Q10, and the selenium plus zinc, and our melatonin, the sublingual form biomelatonin complex, and the melatonin 3 mg Hormonor is a registered drug in Belgium, is our D-Pearls probably the best known product. I think that everyone today is convinced of the benefits of vitamin D. In Great Britain, our D-Pearls is used at this moment by 5,000 British people in a large vitamin D study in the battle against COVID-19. Those things make us very proud. If in the meanwhile, we could mean something for you or your patients, or if you could use a sample of our Hormonor product, you can always contact us. Jerry, thank you very much for this time, and everyone have a really nice day. Bye.
Thank you, Jo. It's really one of the persons who we need to thank, because they help us a lot in our training programs. Also, special thanks to the translation and to those who offer the translation into Spanish and into French. LIMS for French and Bionorizo or Trasalud for the Spanish translation. They're always doing a great job, and I want to thank the interpreters for interpreting. They've done I'm sure they've done a great job. We always hear very good echoes from them. So thank you, and thank you. And thank you all participants to be here. Here are all the social networks where you can get information, LinkedIn, Facebook, YouTube. So join us there also. I'm always happy, and I'm at service. We also have the clinic actually here where I also give some consultation for those who want to go much further in hormone therapies, but we have four excellent doctors that help us with the patients and that are very devoted to patients. We want really that everybody's has what he or she wants for his health. So here's the link for the Hertoghe Medical School, and also the email, office@hertoghe.eu, if you have any questions, any requests. I cannot answer all the requests. We cannot answer all the questions, but we can certainly probably be there if there's really help necessary. Thank you. I hope it was a great day, and you've been a lot, and I must thank you. You were 2,600 to register. Most are USA physicians and health practitioners. And but there's second country is exceptionally now France now. And I think thank you, France. Merci les Français de nous voir. Merci aussi les Belges. Vous êtes aussi 4e en position. Thank you. And see you later. Je ferme le recording, hein, non?